All right. So welcome to the class. It's a head, face, and neck. And the first thing that I do is I talk quite a bit about self-care tools and other things surrounding self-care. And so I'll be showing you some items and talking about how you would use them and or how you would apply them. So the first one that I'd like to show you, since I don't know where it is, it's called a steel point inducer. It's a craniosacral tool. Well, this is a good price for it. Um, Let me share my screen. Where is the share screen? There it is. Okay, so this is the, can everybody see that okay? Okay. So this is called a steel point inducer. Um, this is the original one. There are knockoffs. I don't like the knockoffs because I don't trust the quality of foam. And here it's only about $26, 27 with tax. And you can get it at Massage Warehouse. I like Massage Warehouse because not only is it where I get my stuff, but you can actually get some pretty decent things here for a pretty decent price. You can price check on Amazon if you would like to use them, but here it is. And this is how you would use it. And that particular spot where you would place it here is a release point where your suboccipitals are. They're a little group of muscles that are really annoying, and they're not fun when they get upset. And so there can be major headache drivers, but also just below that point, if you can see my cursor right here, a little bit lower, is your upper cervical. And that is a spot that can also drive migraine behavior as well. And there's lots of things that you can do for it that do not involve cracking your neck or having to stretch your neck. So the things that I'll be teaching today are very friendly for people with hypermobility, although your mileage may vary. If you have severe upper cervical instability, you might want to make sure that it is safe for you. And then I'm trying to find a picture for you here. Why are we starting with shoulder and arm? Okay. Okay, so I wanted to show you some muscles. And it looks like somebody wrote notes in my book. I thought I got a brand new book. Okay. I love that. All right. So if I can get the back side of the head here, muscles of the face, back of the head. Okay. You know what? Actually, I'm going to show you this one because we're going to be doing a lot of work with this today. There's a bunch of nerves in your face, and the slack techniques you'll learn a little bit later. we'll be learning how to contact that gently and putting slack on it so it will relax all of our intricate facial muscles. Can even help reduce tension and stress around the eyes. So if you have eye strain, there's things for that as well that I will be showing you. So the still point inducer I like a lot. And I think that it is a great addition to your self-care library. I like to lay down on it on the floor or on a firm surface, maybe a firm couch or something. And I bring my knees up, which is better than having it all having your spine all stretched out. And that can be just helpful since it's using your body weight. You're not digging it in there. You're not trying to like grind it in or anything, and you shouldn't. It can be part of meditative practice as well, if that's how you would like to use it. How do I turn off screen sharing? I'm not used to this, sorry. Okay, did that stop the screen share? Is it done? No, it's not. Oh, screen sharing is paused. Stop share. Okay, there. Sorry about that. I haven't done that one yet. Okay, so other things for the neck and the head. When we're talking about relaxing and passivity for the neck, you can get something like this. This is the original McKinsey cervical roll from OTPT. They have a website. I'll put the link in the follow-up email so you don't have to worry about it. But essentially it comes in a thing like this. It's firm but it's also squishy. And the way that I use that is when I'm laying down, I put it on my head when I'm laying down, and it passively and gently decompresses the cervical spine, which has many benefits. And that's why some people go to the chiropractor and go get traction, or they get their neck cracked. I don't really think that's great for everything that I know, but I do believe in the benefit of gentle passive traction and decompressive strategies, especially if you have irritated nerves or your muscles are feeling stiff. This can help loosen some of that up. Now, it's a long, slow game for these kinds of tools, though. It's not going to be fast or overnight. It's something you have to build into your routine and use before things get extremely bad. Now, in the case of having a migraine symptoms where you feel it like it's coming from the backside of your jaw and into your suboccipitals or upper cervical, that still point inducer, you can lay on it and it might hurt a little bit, but pain, when we do stuff like that, if it goes up a little bit, then plateaus and starts to drop pretty quickly, that's a good sign that you're releasing something. But if the pain just keeps climbing and climbing and climbing, we want to stop the activity and do something else and then come back to it later. So sometimes with these kinds of stuff, your body may not receive one sensation right away or may not respond to something until you do something else. So let's have a quick word about hot and cold therapy and these things. Start with these. These are fascial balls. The ones with many spikes are nicer, and the ones with fewer spikes can feel more intense. So some people like them. I used to use them a lot more when I thought that I needed to like really feel my massage or something. Now I don't, because I have other methods all the methods and techniques I'm sharing with you today is something that you can build your own toolbox from, that you can decide what works best for you. Since we're all different sensory creatures, there are things that we might like more than others, but these can be effective. One thing that I would do is I would also lay on a flat firm surface, and I used to put this here, right into the suboccipitals, not down here, but up back here. And I would do that for a few seconds to about half a minute or so. But if it was really intense, I would not use it. I would stop, try something else. So for ice, I feel like for migraines in particular, ice is my first line of defense because ice constricts blood vessels and it numbs pain. That said, I don't use actual ice from the freezer. I use ice gel packs. The gel packs are more gentle. They're nicer on my Raynaud's. So when I handle them, they don't hurt me. I'm extremely sensitive to cold water. So if you're like that, when your pipes are still warming up, but you have to start washing your hands and you have pain that shoots up into your shoulder, you might consider using ice gel packs instead. They'll be more sensory friendly. And then if you do have something like Raynaud's or leaky blood vessels from EDS or something, you might want to double check to make sure that using ice as a strategy against migraines, specifically placing it at the base of your skull and the back of your neck or on the back of your shoulders, checking in with your medical professional that knows you well if that is appropriate. But if you don't have those concerns or considerations, I think ice is a great first line of defense. They make gel packs that go on your shoulders and the back of your neck like a little cape, and they like snap in the front like this. And then you can just kind of like lean back in a chair like this to put pressure, or you can lay down with it on. And I use them for about 10 to 15 minutes. And it usually drops my pain pretty quickly. And then I can move on to other self-care methods. Like, for example, once that's numbed up back there, perhaps I would then move into intraoral and I would start massaging the inside of my mouth, which we will cover that material in the next class, which will be on Saturday again. If you have like a lot of stiffness in your neck, or you're just kind of prone to headaches from like really stiff muscles, but it's not acute sharp pain and it doesn't feel quite like a migraine, then I like using heat for that. You can get things like this. I got this at Fred Meyer a long time ago. It's filled with rice and clay beads. And I put it in the microwave. There will always be instructions for how long to microwave these. And then place this weighted clay bead rice heat pack like this. And that can be a nice way to get some deep, moist, relaxing heat into your neck. There's a local company that makes these, and I'm looking for other sources for these because they don't seem to have much in stock right now. And I've actually, my partner had this. This is old. This particular thing is over, I think it might be 20 years old now, but the company is still going. They're called Body Sense, located here in Seattle. And you can see there's only a little bit of wear and tear. The stitching is still quite good and durable. I don't know about their current products because I haven't been able to purchase any, but it's double-sided. This is their small rice pack pillow, and they have like a neck pillow that's like this that you can buy that you can put around your neck, which would probably be better than this. So I'm really interested in getting that one. But this side is more of a non-fuzzy material. I don't know what it is, but I would not put a side like this on your skin without a barrier between this and the skin. This side is okay for me, at least, to put on my skin without a barrier. And then, as you know, with ice gel packs, you would use a barrier with it. Unless you get the double-sided gel packs, like the one that I have has a fuzzy side. And then there's like a more intense non-fuzzy side, which again, I would place on my skin only with a towel. Deep, moist heat can be very beneficial for us. So the way that I use this in particular is I actually use this for this part of my neck and shoulder. I've also have laid on it as well. I've also have placed it here and laid on it like that with my headrest or on a firm surface. And I typically, like to use them for no more than 10 or 15 minutes, just because I am personally heat and cold sensitive. So if you have dysautonomia like POTS, or if you have EDS or mast cell activation issues, then your tolerance and endurance for hot cold therapy may be different than other people. So just, monitor how you feel and go with what your body is telling you it needs. The last thing I'll mention, and I really hate any kind of resist band stuff, but I understand that it can be very useful. So some of you might recognize this. This is a very lightweight TheraBand you can get from the physical therapist. And the reason why it's in class today is because sometimes our deep neck stabilizing muscles are weak. And there's a very gentle, very brief, effective way to get some feedback into that. And if you have a physical therapist, you can ask them about this. But this is how it basically works. And I would make sure you consult someone to see if it's something that you can do. But essentially, is this the right length? You would make a loop. And this isn't the long one. This is a short one. So sorry about that. But imagine that this is going to be longer, okay? And you'll have this around your head. I'll use my mushroom to demonstrate. Come here, little guy. Okay, so you have it around your head like this, right? And pretend that my hand is a doorway, and pretend that he's on the floor. Okay, so my other hand is the floor. The door is anchoring this, and then he's just stepping into it. He's not pushing his neck out or anything. He's just walking into it like this for a couple of seconds, and then he's just walking into it for a couple of seconds. It's basically an isometric exercise for all the little tiny muscles in your neck. I did this actually under guidance of my mentor, because I was still having nerve related stuff from an upper cervical injury I had in 2017. And I do it occasionally. I'm not doing it like a lot. It's not like a full exercise thing. I just do it whenever I feel like maybe I just need a little bit of feedback. And the muscles readily respond to isometric exercise or resistance based exercises. So if you think that you might potentially have a problem with weak muscles, weak stabilizer muscles, you might be able to find this exercise online. I'll try to find it for you too. And then if you have access to a physical therapy friend or a fitness trainer friend, you can potentially ask them for more information, or you could do a health coaching session with me online and I can demonstrate it for you. I've also done custom videos for people where I have shown them how I do my self-care stuff. And then I just kind of leave it open-ended as to how much you want to do. But I'm extremely conservative with it since I am not a physical therapist, but as a peer-to-peer health coach, I want to make sure you know what your options are because not all physical therapists are created equal and not everybody understands how to work with um, complex neck issues as I've personally experienced in my life. And that's why I teach what I do because so many people have been fucking hurt by other body workers and PTs when it comes to their neck. And I'm just not here for it. So that's why I also teach these classes. Like so it's part one and part two are my favorite classes to teach. Okay, so I showed you all the self-care stuff that I have. I'm really bummed I don't have that still point inducer. I don't know what happened to it. I know I didn't do anything to it. Okay. Anyways, so now is the time for questions and answers. So I'll go ahead and look at the chat box. If people want to write or ask questions, I will get to that. So it looks like we have one question. Yeah, so just like the principles of not putting a bag of ice directly on your skin, you don't want to burn yourself or you don't want to scald yourself. That's the basis for it. And also I feel like too the gel ice is just way nicer for your skin. It's not as intense, but it still numb you up real good. Yeah. No, it's definitely a body safety thing, not a sensory thing. However, I do find that even ice wrapped up in a towel, I don't feel it as well. And also, it depends on how thick the towel is. And I feel like for me, I would have to use a thin towel. If I use a thin towel with actual ice, like from the freezer, I'm more likely to feel discomfort with it than if I just use the fuzzy side of a double-sided neck shoulder gel ice pack or a gel ice pack that's just like through my clothing. You know, if I have like a decent shirt on that's like about this thickness or something, that's usually nicer for me. It's just because I personally, it really hurts when my skin comes in contact with something that's cold. Do you have any more questions? Okay. Yeah, there are things that we can do that because the whole entire, it's a very thorough migraine face protocol. And then also you might consider coming to the class on Saturday next week because there are things that happen inside the mouth that can also help the sinuses. And then in particular, also since that question came up, regular nasal rinses is important, especially if you might be neurodivergent, you might be dealing with a histamine intolerance issue or a mast cell activation issue. Not steroid nasal spray unless it's prescribed to you, but you want to clean your nose of irritants and allergens and avoid exposure to fragrances and chemicals because that does build up sinus pressure. I have chronic non-allergic rhinitis. And before I got on cromolyn sodium, my nose was constantly stuffed up. I sounded way worse than I do now. And my nose would be so dry, it would crack and bleed on the inside. And I was constantly itching and scratching my nose. And now I know that when I'm having a histamine reaction to something in my environment or food that I ate or a mast cell activation issue, my nose gets pretty itchy. And I wind up with an itchy, dry spot right behind here that I constantly scratch. And that's a sign of my immune system dysfunction, and it's related to having MCAS, mast cell activation syndrome, hypermobile Ehlers-Danlos syndrome, and autism ADHD with a problem with vitamin B12 intracellular transport. So the reason why I mention this is that many people go throughout their lives not testing positive for allergies, but then they believe that they have seasonal allergies when they actually don't, because they have something going on with how their body processes vitamin B12. Vitamin B12 is extremely important for managing homeocysteine levels, which plays a role in how your body reacts to those types of things. It could also be a sign of gut microbiome imbalances. So, like, for example, I have candida overgrowth inside my gut, which raises my endogenic histamine levels. So, histamine levels that are in the body. And then also having the kind of diet that I had where I was engaging with food intolerances and exogenic, so outside of your body, sources of histamines. And so before I got on cromolyn sodium, I was using molecular iodine saline nasal sprays twice a day, so 2 in each nostril twice a day. And because the preservative in the saline rinse, the saline spray preservative is molecular iodine, it would clean my nose really well, and it would knock down whatever also pathogen that I have in my nose. So for example, they wanted me to get a pneumonia vaccine. I can't get vaccinated because of my immune system, but one of the things that they wanted to do was have me take the pneumonia vaccine or pneumococcal vaccine because it helps reduce some of those symptoms in the nose. So I would have sinus pressure and I would have so much itchy stuffiness that I did a lot of nasal rinses. I used, it's called Air, AYR. I'll put that in the email too, all of this. It's an aloe vera gel-based saline spray. It coats your nose so that irritants in your environment as you breathe through your nose don't trigger the fine hairs in your nose. So if you're overly sensitive, regardless if you have true allergies or not, this coating of your nose with the gel saline spray can reduce your symptoms, help reduce the inflammation in your nose, and therefore reduce sinus pressure as well. So I hope that little bit of information is helpful. Yeah, you all can learn from my experience. So maybe you don't have to go through it for as long as I have. Okay, let's take a 5-minute break. I'm going to stop recording now. I'll let you all use the bathroom, whatever, and then we'll be back at 3:09. Okay, so back from break now. Let's talk about how, since you're all new to my class, let's talk about how like the foundation of this work is done. So watch my hand. So you can see my hand, right? And you see that there's skin here. Okay. So you can see how I'm using my finger pads. And if you've ever seen me for body work, you know what this might feel like. But it's very gentle and it's slow, and being able to move the skin, that's what we're doing with our face. Okay, so take the back of your hand, and I want you to just sort of play around with the skin on the back of your hand. I like to use the back of the hand because it's probably the easiest skin to get a hold of. It's very easy to move it. You're not pushing down in. We're not making marks. We're not trying to grind. We're not trying to like pinch or pull. We're just trying to manipulate the skin a little bit like that. Okay. So the way this will work is I will demonstrate a move on the face and then we'll do it together. So you can watch me first and then we'll follow along. So the first thing that I usually show is how do we release our scalp, because we can have headache pain and the hair is actually a great place to get some leverage to release that headache pain. So I forgot to put my brace on, so I'm going to do that first. Um, um, okay, so now I'm ready. I've got my armor on and I can do it. Okay. So hair is a great place for leverage. If you don't have a lot of hair, that's okay. There are other things that we can do and it doesn't require. It's just those of us that have a little bit more hair to grip can do this. So this is the scalp, right? This whole region is the scalp. What I like to do is I like to warm up the scalp. I like to run my fingers through my hair. I like to gently rub this. I'm just preparing my nervous system for what we're doing. It's just the start of a massage routine. And go through my hair and then be intentional. I'm going to do this. I want to move my hair follicles. If your scalp is extremely dry and just doing this causes pain, you don't have to try this. My scalp used to be in incredibly a lot of pain, and I thought it was neuralgia, but it turned out it is because the shampoo, any shampoo, was drying the fuck out of my scalp. So I only use conditioner now. And I only use unscented Vanicream conditioner, and now my scalp can tolerate contact. But this was like something I hated doing. And now I can actually come in and be with my hair and do this. Okay, so once you have like warmed up your scalp, we're gonna come in like this. I'm gonna slide my fingers through the roots, you see that? And then I'm gonna grab a small handful on either side. And that's all I'm doing. Just real gentle, side to side. I'm gonna release. I'm gonna grab other sections side to side. If my arm gets tired, which it is, I'm just gonna do one side at a time. If this arm gets tired, I'm gonna pause and wait and let blood flow go back into my arms. It's not a race. And then I'm gonna come back up to another spot and do it again until I feel like I've gotten good coverage to just get some feedback into the skin. I'll show you what it looks like from the back. So do that. Small handfuls. I'm not grabbing as much as possible. I'm just grabbing small sections. Just like that. There's the top. Okay. Once you've done that, well, let's try it if you haven't tried it. So, going in and running your fingers through your hair at the scalp level. So, or whatever your hairdresser does that you like. You can do that to wake up your scalp. There's muscles in your scalp. You have like two long muscles right here. This is also, you have cranial nerves that come across as well, things like that, skin nerves. So once we warm up our hair like that, then we can go in and we can do that to warm that up. If you have dysautonomia, you may not like the overhead stuff very much, or you might want to try to do it laying down. And if you shed, you might notice that this will kind of clean up your hair a little bit, and you get some extra hair out. Oops. So that's the scalp warm up. And then the next one, so I like to go top down, which is why I have my classes the way that I have them, is going top down. We think about our jaw and our cheekbone. So here's our zygomatic arch. This is our cheekbone. Find that landmark. Run your fingers over your face. Map that cheekbone out. Okay. Right underneath that cheekbone is the attachment points for a lot of muscles in your jaw joint. Okay. And then above that, you can think of this line, is the tendon for your temporalis muscle. And this is your temple muscle. Okay. So I'll show you. I'm basically gonna put my thumbs into that spot, and I'm not using a lot of pressure, and I'm gonna take my fingers like I have antlers, and I'm gonna plant up here. So now I've got a hamburger. Okay, and I'm going to squeeze the hamburger. So with this that skin contact, I'm gonna squeeze that hamburger. And yeah, my thumb's gonna come up and push underneath the cheekbone, and that's okay. And I'm just gonna hold. I'm gonna lean back because my arms are killing me. I'm gonna just hold this. Now we're holding for 30 seconds to a minute or so, or until you feel things release. When your body releases, it may take a deep breath. You might feel a sense of peace, calmness, coolness, relaxation. And then when we slide out with respect, we go in reverse and we slide out with respect. And already I feel like my jaw's a little looser and the sides of my face are less tense. Now, the other thing too that I want to point out is when you're doing this stuff, you might notice that other parts of your body wake up and start talking to you. And the way that I roll with that is I follow that, because to me, that's communication from my nervous system. You can do it in any order you want. The most important thing is to start somewhere. And then if you want to follow it intuitively, you can go to the next thing that's speaking to you, if you know the move for it, and go from there. And there are tons of moves. There's tons of ways to do this. And that's why every class I teach is slightly different, because there's a million ways to use this method. So after doing that hamburger technique, I noticed that I feel my ophthalmic region of my trigeminal nerve woke up. So I'm going to go ahead and show you how I manage eye strain or forehead tension, which I'm sure will be very beneficial for headaches for you and migraines. Okay, so we have our foreheads, and then we have our eyebrows, right? Okay, so there's two things here There's a spot here and there's a spot here. I'm gonna do this one first. So there's a couple ways to do it, but for this one, you can see me okay. Find the middle part of your eyebrow. Take 2 fingers. I'll do one side to show you. Gently come into contact with the skin. Push towards the midline. But we need to do it both at the same time. So this is what it looks like. I'm not forcing it. I'm just going. And I'm not applying a lot of pressure. And again, we slide out with respect. Once we get into that position, we hold it until we have an involuntary breath or until we feel our bodies relax. It's like that. Okay. The other way to do it is literally if you have hooded eyes like I do. So people with hooded eyes have like a little extra fat pocket here, and it requires surgery to fix. It's really annoying. Um, and it can over time weigh down your eyelid, which increases tiredness and fatigue of your eyes, and it can start to cut into your vision. So you see how much more tissue I have here? Yeah. So if you have that, and even if you don't, you can just come up underneath your eyebrow and lift it up and just support it for like a minute or so. That just lift up those saggy eyebrows. Make sure you can still blink. So if you try to blink and it's hard to blink, you want to like lower a little bit because you want to still be able to have that movement, but you're just that way you know that you're just lifting up the excess tissue or the heavy tissue. That felt really nice. I feel like I don't have somebody's hand pushing down my forehead. So those things all contribute to tension and stress on our face. So if you have um, sagging facial features, supporting them against gravity is a great way to reduce tension and pain and to also promote um, a mood lift. Like I feel a little bit better in my mood because I did that. For me, that's magic. So that's how you would do those two things for those. And then under here. So I'll show you before you try. Right here is a spot where the nerve comes out. So this might squick some people, but this particular spot is where they put a nerve block when they're doing jaw surgery and things like that. They're doing oral facial surgery. So this is a pain reducing point because that nerve is there. So I'm gonna come up underneath the bag of my eye like this, okay, and I'm going to slide it up like this. And you want to start below your eye, like below the bag in your eye. So you're kind of right on the edge of your sinuses, not in this puffy, soft part. A little bit lower, Kirsten. Kristen, a little bit lower. So you see where the bag of my eye is here. So if you put your finger underneath your eye, you want to be below that finger width.
Yeah, I'm right on the edge of the bone there.
Okay, so for you, okay, your eye socket is just smaller than mine then.
Yeah,
Okay.
it's right there.
Okay, great. So that's where you have it, okay? And then we just slide
No,
up.
I've actually been tracking them. They literally had never.
This is what it looks like from the
None of
side.
the re-rolls will work. Maybe this is maybe this is
So we're just gonna hold it. Now you're not applying a lot of pressure. You shouldn't feel like you're pushing into your bone. You should feel like you're just engaging the skin. Okay, I'm gonna slide out. So I did that side. Let's do this side. I'm gonna come up under and I'm gonna bloop like that. And don't poke yourself in the eye. This is kind of a this is one that needs some practice and a conservative approach. There we go. Okay. So we're gonna let our faces rest for a moment since we just did that branch of the trigeminal nerve. And then we're gonna go into the next branch, which is the maxillary branch of the trigeminal nerve. And that will address the sinus pressure and things like that. Plus, there's a move you can do with the nose too, and if people are up for learning that one, I'll show you. But it's a little, it can be a little weird. So my eyes actually feel open and cool, and I feel like I actually got more lubrication on my eyes. So that was great. Now later on in the year, I'm going to be teaching my crash course to upper body self lymphatic, and I will be teaching how to do lymphatic drainage on your face, which will reduce puffiness and isolated points of swelling. That in of itself can reduce pain, improve your mood, alertness, and make you feel relaxed. So if you want to do more stuff with the face later, you might want to consider coming to that class. I believe that one's actually coming up in the next couple of months. Okay, so for this one, so again, you have your cheekbone, you have your sinuses here. Everybody kind of knows where their sinuses are, right? Okay. So watch this. I'm gonna go here and I'm going to bloop. I push it like this. Okay, yeah, it's gonna make you sound like you're sick and you're probably gonna want to sniff. But we're just gonna hold this, okay? It's weird because I actually feel like I have some post-nasal drip now. Like I actually feel like stuff is moving down the back of my throat. That may not be your experience, but it's mine. Okay, there's my breath. So I'm gonna slide out with respect. Okay. What did people notice with that particular one?
It was definitely different. Wasn't expecting that. Felt kind of weird, but cool.
Yeah, yeah, some eye watering. Yeah. Take a big deep breath through your nose. I feel like my nose is more open. Might be something that you have to do a couple times to get there, but there's a second, there's actually two more moves for this. Okay, so the next one is at the ear. So we're at this level, right? Maxillary level. I'm gonna grab my ear like this. I'm gonna pull that sucker straight out. So you can see how this pulls out. One at a time. We're just gonna do one at a time. It's especially important to do one at a time if you have a history of seizures. They teach us this in class, that doing them both at the same time potentially can lead to seizure activity. I have not heard of that actually happening, but that is what was taught, and that's how I operate. So I'm just gonna hold it. When we do this, we're encouraging fluid to go down the eustachian tube in our ears that drains into our throat. Okay, I'm gonna slide out with respect. I'm gonna let that pause for a second before I do anything else. Got one going to the next one. So again, I'm gonna pull that sucker straight out. Get a little bit of a stretch feedback in there. Not trying to yank it out, just gently pulling it till I reach a point of resistance. And that feels great. Wow. I didn't realize my ear was clogged. I guess my ear was clogged because I feel my ears opening up. Okay, good like that. And now I'm going to let it relax. Okay, great. So take a deep breath through your nose. And what did we notice about any change that we may have felt in our sinuses? I feel like the ears are really connected to our sinuses as well. Okay. So next one is, so let's just focus on this sinus cavity. If we just tap our bone, this may sensory wise not be okay for you, but we're just tapping firmly. We're not trying to hit ourselves, but we are trying to get a vibration in the bone. Okay. You're going to do this for several seconds all around that bone to encourage a vibrational movement that will break up and get mucus moving. This is a manual therapy technique. It's basically tapotement for your face. Okay, we're going to stop. You may feel vibration or reverberation there. We're going to stop and just let it work its magic. I'm just so excited that people came to this class. Sorry, I went to bed last night and I was like, I'm living the life I want. I'm finally teaching classes that I want to teach. Just this is like my special interest. I'm sorry. I'm just so excited. Especially for this material. This is my life. I love this. I don't know where I would be with my condition if I didn't have these techniques, because oh my God, was I in pain for years. I was fucked up for years after my injury. Okay, let's go to the next one. So we'll tap all around that cheekbone. We're just trying to get vibration through here. for several seconds. I just want to get that fluid moving. Okay, I'm gonna stop. If you pay close attention, if you put your fingers on it after you do that, and you just listen with your fingers, you sometimes can feel the vibration. My nose feels really clear and open. I mean, it wasn't that clogged when I woke up or anything, but a deeper sense of stuffiness, it's not quite at the front, but a deeper sense of stuffiness for me is going away. How's everybody doing so far? Okay, so I want to ask, do any of you struggle with tinnitus? Your ears ring? Okay, cool. So yeah, just maybe be gentle with that tapping then, or maybe just try to like, because you can also massage it. You could do this a little bit, but that's going to work the muscle and the fascia a little bit more, and that could still be useful. It could just be that you're a little bit irritated, but don't mess with that nerve if it's starting to feel sharp or it's like increasing in pain. Like if you don't feel like it's helping, then just give it a rest. Okay, so for the stuff with the ears, here's a good time to use it. So if you're in bed and like 4 in the morning rolls around and all of a sudden you were starting to fall asleep, but all of a sudden there's a sudden sharp ringing in one or both ears. And it's like, for me, I feel like it's a histamine dump thing. I just think it's just my mast cells doing shit or histamine intolerance, whatever, something's happening. And I realized that, well, there's a cranial nerve accessible there. And I learned this from a book about cranial nerves. And I started to apply it in these situations. And oh my gosh, it actually has, more often than not, stopped the ringing in my ears. Now, the ringing of the ears can be a symptom of many different things. And so it's safe to try, but you may not get the same results as me. Okay. So I'll show you. So you can see the ear here and you see this part of the ear. Okay. I take the biggest finger that I can fit in my ear. So this one. And I hook behind that tab and pull forward. Okay, so I'm curling behind the tab. I'm not trying to like dig in my ear or anything, even though I do feel like I have quite a bit of wax there. But I'm just putting it here and I'm hooking it and pulling it forward. You see that action? You see how it pulls us forward? That's what we're trying to achieve. And I do this for a few seconds to half a minute or so. I've even done this when things start to get extremely loud for no reason. And it does seem to help. We're also decompressing the ear and part of the job by doing this. Okay, I have my breath. I'm going to slide out with respect. Wiggle your jaws. Notice if that made a change, because I feel like it did. So this is also segueing into the bottom part, and this is also part of, I'll revisit this particular thing in the intraoral class. So let's go here to this ear so you can see it. Boom, hook forward. See how I did that? And this ear canal is actually bigger, so I'm gonna stick more of my finger in. I actually have asymmetrical ear canals. This one's actually really, I need like extra small earplugs for this one, and then I need like small earplugs for this one. It's like having a child's ear on this side. It's, you might notice that that one ear hole is smaller than the other. Bodies are amazing. Okay, let's slide out with respect. And I personally feel like my hearing is clearer. I have a kind of an audio processing disorder issue, and I think some it has to do with yeah, sensitivity or irritation to my cranial nerves. So swallow, take a big swallow. You might notice your throat is a little bit more open, that swallowing is smoother now. That's what I notice. I feel like my jaw is a little bit more open. And overall, I feel like my face is like almost like I had washed it or something. You know, like when you wash your face, you feel all relaxed and comfortable. Like I kind of feel like that's going on now. So, okay. So let's go to jaw now. And so here is your, from here to here and from here to here are your muscles and your jaw joint. The TMJ is right here. This is what we're going to start with. We're going to come from the bottom. You see that angle? I'm going to come up. I'm going to skip and push up. Sorry, I'm also itchy today. Okay, I had my breath. I'm going to slide out with respect. Okay, let's do the other side. So here's the muscles. I'm going to start here. Push up towards the ear. And we'll slide out with respect. Okay. What did everybody notice with that one? I love these closed captions. They always choose the wrong words for me. What did everybody notice with those moves? Me too. No, yawning when you're doing this work is a great sign. It means that you're engaging your nervous system in a safe, positive way and that you're starting to relax. It's not uncommon for people to feel sleepy after receiving body work from me, or it's not uncommon for me to make myself sleepy when I'm doing this. Okay, so your temples were talking to you. So I have another thing that we can do for the temples. I actually got a couple of things you can do for the temples. So we can actually get more specific with the temple. So you see where I've got my fingers? I'm gonna squeeze that tissue together just a little bit. And I'm not pushing into things, but you see how I kind of grabbed a little bit of the tissue if it's possible for you. Oh, wow. I can feel that in my scalp, like on the top right here. It just feels like, I don't know. Um, and when you're doing this, it might slip out of your fingers as you're doing it, and that's okay. So you can kind of see how my fingers are getting closer together. It's slipping out. That's fine. But I always spread back out to release. Wow. I made that one up on the spot. Okay. And then let's grab the other side. Okay, just like that. Okay, that was my breast, so I'm gonna slide out. I'll let you play with that for a little longer. And I know when I did that, it made the back of my scalp light up again. That's okay. It just means that there's more work to be done, that your body just has more work to do. So I'm going to just kind of like put more. So I'm doing this with my hand now. I'm like actually gripping a little bit more to try to massage that spot out. And for me, it's that spot that feels like a crack in my skull. Does anybody ever get that on their scalp? It just feels like there's a crack in your skull. Yeah, that's part of a nerve muscle thing, and it's right over where I have a very pronounced fusion in the plates of my skull. And so I'm just literally in the groove where I can feel the plates of my skull, and I'm just, you don't have to do this. I'm just doing this because I feel like I need it. But it's like I'm like really grinding into that tissue right now and you can do that if you want, I'm just kind of following the fissure pattern here. Oh, wow, that's tender. Okay. I do feel better, so I'm gonna stop messing with it. And then the next one for the temples. If you go to the end of your cheekbone where the tendon for the temples goes underneath, I'm gonna just come a little bit under that. I'm gonna press in and push up so it feels like my fingers are pushing underneath my jawbone. You're gonna be in some tough, like steak-like tissue. Okay. And then all you're going to do is you're going to do this. You're going to let your jaw relax. I would not do that for very long. And I would not try to move your jaw as much as possible. It really is just that like quarter of an inch movement from side to side, especially if you have a history of subluxating your jaw joint. This particular technique may not be okay for you. So I'll show you again on this side. I'm gonna come down, here's the cheekbone. I'm gonna find where the bottom of it is. I'm gonna go a little bit under. I'm gonna push in and scoop up so my finger hooks underneath the bone. So this finger is underneath the bone. This finger is kind of on the edge of the bone. Okay, but I got my fingers together so they're bracing because I need to be able to protect my finger joints. So I have to have these fingers together. Okay, I'm gonna relax my jaw again. And you can see how it pushes against my finger, right? It's kind of a combination of a little mini stretch and a resistive. Okay. I'm gonna let our jaws rest for a second. Okay. Okay, now I'm gonna feel my face. And I feel more open. I do notice, and this may not make sense to you right now because you haven't taken a second class, but I noticed that I still have more work to do. If this was my 4-hour workshop, I would want to really get in there and massage that out, but I can show you how to do that on next Saturday. So, but it's still really bothering me on this side. This side feels really tight and tense, and I really wanted to do something for it. So what can I do on the outside for that? Still, I could do this. I can take my muscle. So find the edge of your muscle, have your jaw open a little bit. And you push straight back like that, you're in muscle, right? Okay. I'm gonna grab that. If this feels like it's compromising your jaw joint or it's too intense, don't do it. But I'm gonna grab this bundle of tissue like that, and I'm going to lift it up. And you'll notice that my fingers will slip. This feels fucking great. Oh my God. That was spectacular. This is the other side, so I'm going to locate that bundle muscle. Okay. So I'm picking the sucker up. Oh, there you go. And now I feel a lot better. I still kind of want to go. I know on me where that spot is. I really want to do that, but I feel like I can go about the rest of my day without doing it now. So more open. I feel like my muscles are moving better. I feel like my eyes are less tense. So now we have another section for questions and answers before I show you the last wait, no, it's like one technique, two techniques. Wait, let me show you the two things for the neck in this class. And then yeah. Okay. So for the neck, all the self-care things that we talked about, we're really targeting for the neck. So you have a lot that you can do already. There's only a few techniques that I can show you that are possible to do on your neck while sitting at a computer. So I want people to pay attention to my clavicle on the top of your collarbone. Okay. Then you see the line of your neck and you see the triangle of your upper trap. Right here, this is spongy, it's kind of watery, so you can check it for comparison. You can push into the top of your pec, feels like steak, dense tissue. And then when you come up here, it's soft and squishy, right? We're going to push down a little bit and scoop up. You shouldn't be on your pulse. You're in the neurovascular bundle, but you shouldn't be pushing on your pulse. I have my breath. I'm gonna slide out with respect. Wait a second. I'm gonna move my shoulder. Shoulder feels a little bit more free. Let's do the other one. So here's the clavicle. There's a triangle. It's the center of the triangle, essentially. Press down, scoop up. Again, you're not pushing very hard or anything. But as we push down and pull up, we're putting slack on our brachial plexus, which comes out of our neck, which we covered a lot more of that in last week's class. Slide out with respect. Okay. Now, for some people, a primary headache driver is this sucker, the sternocleidomastoid. He is a grumpy fella. He's very tired of holding your head in a forward posture when you're like at your keyboard. He does not like that. So we're gonna give him, we're gonna uplift him a little bit. Okay. So you see, this is the muscle, right? Okay. I'm gonna turn my head so I know where he is. I'm gonna turn my head forward. So now you see how I grabbed him? And then I'm going to just lift him up towards the ear. Now, I'm not pulling very hard. I'm not using very much force. Bring your head back to neutral, Raven. There you go. You see how much more you have of that now? Yeah. Oh, sweet baby Jesus. Okay. I always wait, like I have these classes, I wait. I don't do any of the stuff before the class so that you can actually see the effect. Okay, and then here's the next one. And then I'm gonna just lift him up. Slide out with respect. Let's let him rest after we are done with the contact. Yep, we can roll our shoulders. I feel like even the backs of my shoulders are looser now. I feel like my upper spine kind of popped a little bit as well. Okay, so now let's check in. How has everybody been doing so far? Okay. And then I know, isn't it so cool? I have, you're the first person to ever say that in one of my classes. You are my favorite student now. I'm just kidding. I don't have favorites. I really like everybody equally, but yes, this is really cool shit. This is the best fucking coolest shit ever, and that's why I teach it. I don't teach other massage therapists. My mentor can do that. I teach people how to do it to themselves. Okay, so now here's our last section for questions and answers before I give you my end of class speech and shameless promo. So this is your time to talk, discuss, ask questions. I have an overbite. See? So all the techniques that I use are already with that in mind. I don't know of any actual adaptations for that. I've been inside many people's mouths over the years, and I've been in mouths that are very crowded and have a high palate, and I've yeah, I don't think there's really adaptations per se. Um, yes, but it's anterior neck work, and there is so much that can go wrong there if you don't understand the anatomy. So if you want to learn how to do specific anterior neck massage for yourself, I really recommend doing an in-person coaching session with me, because that's going to require like pulling out books and making sure that you understand what your risks are. And then I can also go through like if you have any considerations having EDS at all. You might honestly try putting a cold pack on your face, like getting it sounds like some stuff woke up for you during this experience or for experimenting. So I would do this. I would go get a washcloth and I would put it under cold water, wring it out really well, and then put it over your entire face for about 2 to 5 minutes. That's also another self-care tool. If you are finding that you're having a little bit of something that's kind of annoying and it feels nervy, you can basically do an analgesic with a cold damp cloth. The other thing is, hang on, I forgot to bring this out. Let me show you this. And of course, I'll put this on the email. But essentially, if you don't have these, you'd use a washcloth. But they make these double-sided. These are not ice packs. These are cold packs because you don't really want to put ice on your face. You really actually don't. So for your particular situation, if I had something like this, tighter on my head, and this, because I feel some irritation up here too, but also when I'm in front of the ring light, it basically starts giving me a headache in every one of my classes. It's just because I'm photosensitive. So this can actually help reduce that discomfort. You can also get ones that are a full pack like this. And then if you're wanting to get rid of puffiness or isolated swelling in your face, they make these reversible ones. And so I bought this whole set for some self-care when I'm having headaches or facial pain. I don't use it that much. I use the Slack techniques more than anything because that's what works best for me. But when I'm actually super acute, that's what I use. And then this also can double as if you want to get creative with it, you can put this on your neck as well as a cold pack during a hot day as well, or just for some feedback, and lay on it. And then you've got a couple of things to help if you catch your migraine symptoms early enough. This can be very helpful. Yeah. This feels nice. Like I feel very comfortable with this. I like the cooling sensation here and there. It feels really nice. So, sorry I didn't mention that earlier. I was focused on the other things. Like I said, every class is different because there's a million things that you can do. There's so many self-care toys, and finding out what works for you is more than half of the journey with this. I'm just here to help point you in the direction and help guide you to better options. So yeah. And then you can see it took down some of my purpleness already. So this can be a great beauty hack as well. And also get just lymphatic drainage as well. So yeah, that's what I would do. If it's bothering you, I would get a wet washcloth right now, wring it out, put it on your face. I remember leaving my mentor's office when he was working with me after my neck injury. And he told me there's a CVS right around the corner. Go get one of those disposable ice packs and put it on the back of your neck when we're done. And it helps a lot. It would prevent me from having a flare up as well. Because when we do this work, we can also have a protective response from our nervous system, which then creates inflammation. It's just kind of part of the method is that there's some understanding and acceptance that there will be some discomfort at some point. You could potentially trip your wires. I had a class late last year where I showed a move and I did it on the bad side of my neck. And I then ended up having to show the class how I calm down when I cause my body to have a visceral panic attack. So they got to see firsthand what my emergency procedure was for accidentally making my body feel threatened because I had done something to change my autonomic nervous system by accident because I was so close to my carotid artery on a move that I did. And I just have a specific structural issue that is part of my upper cervical problems, and not everybody has this. And I thought I was okay to do it on that side, and that's why I always start with this side first usually, because I never know. And so yeah, that was a thing. So if you do stuff to your face or your neck and you wind up feeling nauseous, dizzy, anxious, your heart rate starts to speed up, you can try to calm your system down. And the way that you would calm your system down, I might as well just go over this, is I would lay down or sit down and lean back, and I would literally rub my belly. I would rub my belly like this, and I would rock my belly. The belly is one of the quickest ways to get back to a parasympathetic nervous system state. So you see how I'm rocking myself? That can help us feel more comfortable when we've upset things by accident, but we have to stick with it. It can take a few minutes to really calm down. If you're prone to dissociation and your nervous system is like not sure how to receive this work, then you can do things. You can rub your arms, you can pat your arms, that kind of stuff. You can drum on your belly. Basically, distraction technique. It's not that you hurt yourself or something bad is going to happen. It's just that when we are messing with our nerves and we're that close to things in our necks, and that's also why like I don't show too many front of neck stuff. Our bodies can perceive it as a threat. Our nervous system is an animal. And that's also why we pause between moves, because we don't want to overstimulate ourselves. We don't want to introduce too many things so close together. Do I have any other questions before I go into the end of the class speech? Okay, so I really appreciate everybody coming. I'm so glad that you're curious about what other things you can do for yourself that are not medication or even like going to the doctor dependent. I feel like the more that we can learn to do for ourselves in a safe and informed way, the more empowered we are as patients, and the more that we can like advocate for ourselves. So really appreciate you being here with me today. I would love it if you could help me out with something. So something that I have noticed in our community is that word of mouth is really important. I have been in the COVID aware community for over 2 years, and I started my massage and coaching practice in August of 2022. I still don't know very many people in the community, and I still have plenty of room in my practice for clients. What I've noticed is that clients come to me when people talk about me. For example, recently somebody made a post about my classes, and that same day, 3 people signed up to my Ko-Fi to support me and to be in the learning enthusiast tier. And that's really important because there are people who get free tickets who are on my mutual aid list. We have at least one of those people here today. That funding for that is provided by my Ko-Fi supporters. And so the more word of mouth that we can share, the more you can share your experiences, good or bad, the more people will be able to find me to get the care that they need or to find opportunities to help me provide this care to someone else. So please do not let me be your best kept secret. Please overshare. Please spill the beans. Do not gatekeep me. This is my life's purpose. And I have worked really hard on my own personal health to be able to work more hours so that I can do this. This is really what I want to be doing. And I want to be doing it for everybody in our community because there's so few providers like me, let alone providers like me who also still use a quality mask, care about clean air, or who even understand the nuances of ME, EDS, long COVID, etc. So if you want to process the class today and write about your experiences sometime later, you can tag me in it. I would really appreciate that. So I really appreciate you all coming, and I will let you go now so that you can rest and enjoy the rest of our day. It looks like the sun's about to set and there's still clear skies. So that was nice to have a nice day. Really appreciate being here with all of you. And I'll stick around for a couple of minutes if people want to chat before I go on to my next thing.